All right, good morning, everybody, and thank you for taking time out of your Saturday to learn a little bit more about CareValues online systems, tools, and technology. My name is Kyle Christie. I am a sales director here at CareValue, and today we're going to be discussing the CareValue website as well as AllRep, our proprietary CRM program. So some of the topics that will be covered today is logging into AllRep for the first time, navigating the CareValues site and accessing all the features, updating leads in AllRep, tracking submissions, policies, and enrollments, agent details, storing passwords, the medicine cabinet, form search, and last but not least, SAM, CareValues Secure Application Manager that makes submitting apps both secure and easy. So we're going to go ahead and get started. First thing to do is to log into www.carevalue.com. Now, when you get access to AllRep for the first time, first you become contracted with CareValue, and then you will receive your AllRep link. In the chance that it gets buried in your emails, it's not a worry. There's an easy, simple way to get set up, and we're just going to go to Agent Login right here in the upper right-hand corner. We're going to click on it. And there's a forgot your password link right down here. So we're going to click on this. I'm going to enter in our email address. And we're going to click on the password reset. Now, it's important to note with the password reset, there is a time window for it. It's a 20-minute time window. So from the time the email is sent to you, the link in the email will only be active for 20 minutes. So we're going to check on our email quick, see if we received our password reset. There it is. And it will come from CareValue info, and the email will look just like this. From there, you're going to click on reset your password and follow the prompts to do so. So I'm going to log in real quick after I've reset my password. And we'll get signed in. Now, in order to access all the features on the CareValues site, you're going to need to be logged in. This is separate from the AllRep site. This is CareValues' actual website. And in it, there are some features that will be very beneficial to agents, and we'll go through those right now. So under products, you'll see that we have all of our products broken out into senior, life, and the health division. I'm going to click on Medicare Advantage quick. You can see the carriers that we work with featured here. I'll click on Aetna. And then additional carrier information. Now here you're going to have access to quick links, contacts if you need to get a hold of broker support, information on getting certified with a carrier, information on submitting business, compliance, and making sure that you are ready to sell. So these features are available with all the carriers, and it's a great resource to have if it is an off hour, the office isn't open, and you need to get a hold of that information. Under leads and marketing, you'll see some of the retail programs that we have first in line access to. Under leads, you'll see some of the lead options that we work with. And under carrier incentives, you will see up-to-date carrier promotions and things that you will have access to. Under technology, managing your business, there will be a link for AllRep. There's a link for events. So if you're curious about what webinars are coming up that are carrier specific or generic CareValue events, you can find that information there. I'm going to go right now to the Medicare Agent Resource Center. Now this is what we call MARC. This is your sales director out in the field when the office is closed. And again, you'll be able to access all the information that you need in the field right here. So we're going to click on Aetna again, and it's going to bring us back to that same page. And again, under technology, here you have access to some of CareValues quoting engines for the first time. We have a theme with all of our technology, and that's that we want you to be able to access it from multiple locations. So we have the quote engine on the actual CareValues site as well as an AllRep. So right now we're going to go through the quote engine. I'm going to click on Medicare Advantage quote. I'm going to type in a zip code. It's going to auto-populate the county for Ontario. The plan is Medicare Advantage. The effective year is 2018. I'm going to sort by price from lowest to highest. So I'm going to click on Get Quote. And you'll see all the plans starting with the $0 plan options are going to generate. Now, if I want more details on one specific plan, all I need to do is click on Plan Details down here in the corner. And you'll be able to access all of the details. I'll click on Back. One of the nice features of our quoting engine is that you can do a side-by-side comparison of all the plans. So we're going to click on Excelis, we'll click on United Healthcare, and we'll click on Aetna. You'll see as I'm clicking on these, they're changing from blue to green, and they're generating over here under the Compare Quotes. So I'm going to click on Compare Quotes quick, and you'll see you can run this side-by-side comparison. If I click on this print button, I can print just this page, or if I'd like to store a PDF on my iPad or on my laptop, I simply click on the PDF icon. It generates a PDF or portable document file right down here. And you have all the features side by side once again. So this can be a helpful tool out in the field if you're working in an area that you're not familiar with and you want to know what plans are available and what's going to make the most sense for your client. However, it's important to note that these are not to be met or not to be left with the client. So they shouldn't be shown, they shouldn't be left. This is agent-facing material, and this is for your eyes only. So we're going to click on Back quick. And this will take us back to our main page. If I want to change the type of product that I'm looking at, I'd simply scroll over the Medicare Advantage, and you'll see the drop-down screen will activate. Let's click on Medicare Supplement. I'll enter in the zip code. I can change the specifics of this. I can go mail. I can change through all the Medicare Supplement plans. We'll look at a Plan F in this case. I can sort by price, and I can choose the effective date. So we're going to go ahead and click on Quote again. And once again, you see that they are all listed, priced from lowest to highest, one right after another, excuse me. So we're going to click on the top three once again, and you'll see that it's generating under Compare Quotes. So we'll click on Compare Quotes, and there you have your side-by-side comparison. Again, all the options that were available with Medicare Advantage are available with the Medicare Supplement. You can make a PDF, or you can print off this page as is. So this quoting tool is available in AllRep. And again, we like to make sure that you have multiple links that will take you to these destinations. So scrolling over under Education, you'll find your link to your AHIP. If you run out of E&O insurance or your annual membership is up, you have the option to purchase discounted E&O from one of our vendors. If you have questions about CE credits or some of the training and events that we're doing, you can find that under the Training tab. And any news or updates that you want on plans or carriers can be found right here under the Content Library. So with that being explored, we're going to now log into AllRep. So remember, we logged in the beginning, and we have a lot of different links to choose from to access AllRep. I can click on the scroll down bar and the AllRep link is right there, or I can click right here in the center and go straight to AllRep. So I'm going to do that. Now this is AllRep. This is CareValues proprietary CRM, or Client Relation Manager. Here you can store client data, you can track submissions and policies, you can store your leads, as well as house all of your important login information, writing numbers, and anything else that you need to be successful in the field. The first feature that we're going to explore in AllRep is going to be updating our leads. So really quick, I am going to log into the agent view. And you'll see I have a demo agent right here with dummy information, so I'm going to access his view. And now this is what you will see as an agent in AllRep. So you have two options to navigate AllRep. You have the dashboard right here where you'll see all of your tools, form search, all the quoting engines, SAM, our Secure Application Manager, or you have the option to navigate right here along the side. So we're going to go to the side quick. I'm going to click on Opportunities. I'm going to click on My Opportunities. Now, when you receive a new lead or a lead drop from CareValue, your opportunities will be loaded in here, and you will receive an email when you receive a new lead. You have the option to filter it right up here, and then you have the information located right down here. So you'll see under Source, there's a variety of different sources that you can access. If I have a BRC and I want to print off the lead card to take with me when I go meet with the client, I simply click on BRC. And then I can view that file. I can download it or I can print it, whichever I choose to do. And you'll notice that when I click on it, it creates a new tab. So I don't have to keep going back and forth. I can go back to my opportunities. And let's say we met with this client right here. So it's important to keep your leads updated. That's the way that our compliance and lead member can track and make sure that you are out there working these leads when we give them to you. And agents who work these leads and keep them updated are more prone to receive more leads because we simply know that you're out there doing your job. So in order to update it, we're going to look under daily activity and we're going to click on waiting. Now you see that 3 options generate. I can reschedule the lead, I can close won the lead, or I can close lost the lead. Now, if you close lost the lead, that lead will be entered into a pool that other agents have access to. So if you never want to talk to this person again, you can close lost it. If you meet with them and they say that they're happy with their plan and they're going to stick with it, and you're more than welcome to talk to them a year from now, simply reschedule it for a year from now. So in this case right here, I'm going to click on reschedule. I'm going to provide a quick explanation of what happened. Happy with their current plan. I'm going to select the contact date. For a year from now. The result, staying with prior. And I can enter in their current carrier information. So let's say they're with Aetna. I'm going to save and add. And you'll see now that the note has been added. The daily activity has been changed to schedule. and I have successfully updated this lead. So please make sure that you're updating your leads throughout AEP so that we can keep sending them your way. Now we're going to move on to tracking submissions, policies, and enrollments. Right over here along the side under clients, you can access policies, submissions, and enrollments. So we're going to click on policies quick. You're going to be able to see the policy number, the policy holder, and the status of what the policy is. We do reconcile this data with the carriers on a weekly and bi-weekly with some basis. So this information is housed by not only us, but the carriers as well. We're going to click on submissions. And apparently Doug hasn't been working very hard this year, so he doesn't have any submissions. But again, you'll be able to see the plan effective date, the signature date. You'll be able to access the Medicare claim number and see the submission method, whether it was electronic through lien or if it was submitted directly through us through SAM. And then finally, we're going to click on enrollments. And as you can see, these are the carriers that we received the data from and the last date that we received that data, so you can reconcile that information with them. So with all of the different carriers that everyone works with, it's really difficult to keep track of all the writing numbers or even just to remember who you're appointed with. So CareValue took note of this concern and addressed it. So we're going to go to agents right now. I'm going to click on My Agents. And we're going to click on Doug's name. And we're going to click on Agent Details. So here you're going to see all of your basic agent detailed information. You're going to see what the email address is, what the phone number is, and what the address is. If something changes and you have a new work phone that you'd like us to use or a new email address, you can simply click on New, type in new email, and then set it as the default. We will send emails to that email from now on. I can check and see when my license number and when it was effective and if it expired, and same with E&O. And then the important piece is under contracts. Here I can see what carriers I am currently with and what my writing number is. So with each carrier obviously comes passwords and login sites and certification sites. So a good place to house all that information is going to be right here. I'm going to click on the drop down next to my name, and I'm going to click on passwords. Here you can see I have all of my portal information. I can simply click on it. I enter in my PIN code. And I can access my information from here. I have the host site, I have my username, I have my password, and it's all one convenient location. So the only password that I have to remember is my AllRep password. In the case that I forget it, I can reset it. So right now we're going to go back to dashboard. And we are going to access our new feature, the medicine cabinet. So I'm going to click on MAPD quote. And again, this is just a temporary button right now to access the medicine cabinet. But you'll see that you have the opportunity to pick the location of the client as well as the prescriptions that they're taking. So I'm going to enter in a drug. As soon as I start typing, it'll search for it. And then it will generate what my options are with those letters. So I'm going to click on Lipitor. I'm going to choose the dosage. It's going to take a second to load. Look at that, a generic alternative was found. So if a generic alternative is available, the medicine cabinet will auto-populate that information and give you access to it. So we're going to click on yes. I'm going to select the dosage. I'm going to choose my quantity and my frequency, and I'm going to save the drug. Now I can enter in my client information. Auto-populates the county. The date of birth, I can just type that in. Requested effective date, I can dictate what their general health is, what product types I'd like to see, and I can go ahead and get the quote. Now in this example, I only entered one prescription, but you can enter multiple prescriptions for a maximum of up to 25. Here along the top, you'll see I have the options to view what type of plan I'd like to look at, if I want just Part D or if I want Part C. And all of the carriers are listed right here. From here, I can locate the client pharmacy. Let's say I want within a 2-mile radius. And then I can pick which pharmacy they would like to go to. So this is a really helpful tool with clients who have a lot of prescription drugs, and rather than searching through each individual formulary and making a list, this is an easy way to do a comparison of all the plans side by side so that you can make the best choice for your client. And again, this is located under the dashboard, and it's currently located under MAPD quote. And from here, we're going to access a form search. So let's say you are in a house, you have the option for life and Medicare forms. We're going to look at Medicare. But let's say you're in a house and they don't have Wi-Fi, and you need to access a formulary so that you can make sure that you're making the right drug choices for them. This needs to be done ahead of time, but this is a location where you can find all of the carrier formularies. So we're going to click on product type, Medicare Advantage. We're going to click on the plan year for 2018. We're going to select the state. As New York. And then under county, we are going to click on Monroe, and a carrier again will be Aetna. So as you can see, the summary of benefits is right here. The formulary is right here. And all that information can be downloaded and uploaded to an iPad so that you can have it on you. So again, to navigate, again, you can go to dashboard right along the side as well. So we're going to click on dashboard. And it's going to bring us back to our dashboard. So at this point in time, we're going to go over SAM, our Secure Application Manager. This is the only way to submit business to CareValue moving forward. And the reason that we did that is simply for cybersecurity. Carriers have strict compliance regulations, and we want to make sure that we are following through with that and making sure that our agents' information, PHI and PII, is secure. So we're going to click on this quick. SAM is an easy 4-step process. Under application disposition, I'm going to click on the down arrow. And you'll see I have 2 options, already submitted to carrier or submit to carrier for processing. An example of already submitted to carrier would be if you submitted the application electronically, either through Lean or MAPA or Ease, and submit to carrier for processing is a paper app that you have that needs to be sent directly to the carrier. So we're going to submit to carrier for processing. We're going to enter in the beneficiary last name. We're going to enter in their zip code, and we're going to select the agent. So I am going to leave Doug Flutie's view right now because I'm not sure which certifications he's gotten complete. And we'll enter that information quick. So now I am the agent. You'll only have the option for you in this instance. We're going to click on check opportunities, and you'll see no matching opportunities. Now, if I had a opportunity whose last name was Wayne, this would populate and give me the option to select that person, and then the next step would populate the information from there. So we're going to click on yes. Beneficiary first name is Bruce. They're HICN. You'll see you have two options. You have the HICN or the MBI. The HICN, the traditional red, white, and blue card, will begin to be phased out and replaced with the MBI card. So you may run into that if this AEP. There is a timeline for it. And CareValue wanted to get ahead of that curve and make sure that we gave our agents the ability to enter in beforehand if they ran into that situation. So only one is required. In this case, I'm going to enter in a Medicare claim number, their date of birth I can type in. Go. And their county, Monroe. And again, I am the writing agent. Again, you will only have one option for writing agent. We're going to click on next, and we're going to select the plan info. So for the product type, we're going to click on Medicare Advantage. The effective date is going to be 1/1. The signature date, let's say they signed it today, and let's say I received it today. We're going to select the carrier. We'll say this one's United Healthcare, and we'll say they signed up for a plan 1, and you'll see that the form number populates down here. From here, we're going to click on next, and we have the option to drag files or simply click in the box and find them wherever we have them stored. So in this case, I've got an app, I've got an Epic, and I have a scope of appointment. I'm going to select all three, and I'm going to click on open. From here, I can dictate what the file type is. So Bruce Wayne app, obviously the application. Bruce Wayne Epic, going to be an Epic app. Then Bruce Wayne scope of appointment is going to be the scope. It's important to note that the Epic application needs to be separate from the application and the scope. However, if you would like to scan and upload the scope with the application, that can be done. So now that we have everything uploaded, I'm going to click on next. I'm going to review my information. In the case that I spelled something wrong, I simply go back to the step where it was spelled wrong, and I would correct it right here. Everything looks good. Now, it's important to note under Submit Application that you only need to click on it once. It takes a second to load. I'm going to click on it, and I got my green check mark, and I know that's a success. I'm going to click OK, and it will take me back to the beginning. Now, some things to note with SAM. Just like AllRep, it needs to be used with Google Chrome. And before I enter in any new information, I'm going to want to click the refresh button in the upper left-hand corner. We're going to go back to Dashboard. And I can check the submission status through my email, as well as through pre-carrier status. And you'll see all the information is housed right here. So that concludes the training for AllRep as well as SAM. I, again, thank you for taking time out of your Saturday to spend some time with me this morning and learn more about CareValues online systems, tools, and technology. I hope everyone has a great AP and a great day. Thank you.